Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the Appalachian Highlands. As I've mentioned before, the rate of growth in the U.S., the week-to-week growth rate, has decreased considerably. Early on, it was doubling every week. Now it's growing at about 3% a week. If we look at Virginia, it's slowing down as well, but not quite as slow as the rest of the U.S., again, suggesting that it's still a little bit earlier in the pandemic. If you look at cases in Virginia, they grew rapidly, came down, went back up, and maybe are coming back up again. I'm not a big fan of using cases because it's dependent on how many tests you do. But if you look at deaths, there was this rise, this fall, rise, and almost like watching a bouncing ball. And if you look at all the cases in Virginia early on, they were in the peri-urban areas. And in the last 2 weeks, you can see it starting to spread more into the rural areas. And this is, again, the natural progression of the pandemic, spreading from urban areas to non-urban areas over time. Tennessee has also seen this drop, though not as low as the rest of Virginia, the rest of the U.S. And again, a slow growth rate. Finally, it went up and it came back down in total cases. As we've learned this week, the definition of a case can change. So I prefer to look at deaths. And again, in Tennessee, deaths were growing slowly but consistently over time. We may be seeing a drop in the daily number of deaths, which would be a good thing to see. If you look at all of the cases in Tennessee from the beginning, they were in the peri-urban areas. But as it spread, now these in the last 2 weeks, you can again see it spreading outside those urban areas. And this is, again, the natural progression, what we would hope to see. In terms of the Appalachian Highlands, hospitalizations in red, cases in blue, and you see that until early August, they paralleled each other. Now the number of cases has gone down. But when cases go down in the face of hospitalizations going up, you have to realize that this is either because patients are sicker, more of them in the hospital, or that hospitalizations reflect earlier cases, but much more likely we're simply not doing enough testing. So the hospitalizations and deaths don't lie. Cases don't necessarily represent what we're looking for. In terms of all the cases in the Appalachian Highlands, we've seen this continuous growth rate with an 8% increase in the past week. However, if you look at deaths, which I think is a better measure, it's been almost a 10% increase in the past week, very much looking like the rest of Tennessee. As I pointed out, Tennessee's week-to-week growth rate has slowed down to about 7.8% a week. The Appalachian Highlands are a little different in that because of smaller numbers, it goes up and down. But you can see a general pattern down, maybe a little bit behind the rest of Tennessee. So the way I think of it is the Appalachian Highlands are being hit a little bit later than the rest of Tennessee. Tennessee's being hit a little bit later than the rest of the United States. But hopefully we'll continue to see a slowing of the growth rate. But we haven't got to it yet. It is still time to take this epidemic seriously, especially here in the Appalachian Highlands. We've had 160,000 cases and almost 1,800 deaths. Virginia's had 125,000 cases and almost 3,000 deaths. And our region has had 575 deaths. As I pointed out before, about 1.1% of all the people in Tennessee that are known to be infected have died, about twice as high in Virginia, and we're midway here. And what this reflects is the number of tests that are being done. It's not reflective of quality of healthcare or anything else. So again, be very, very careful about using cases as a way of following what's happening. Look at hospitalizations or look at deaths. So we're still in the midst of an evolving pandemic. As I say, it's hitting our region a little bit later than other places, but hopefully we'll start to see a leveling off in the near future. Until then, we have to continue to take this seriously. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our listserv, please let Jan Stork know. I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. And as always, if you have any questions or comments or any topics you'd like to see us cover, please let me know. I look forward to hearing from you. Thank you very much.